So there's another condition that could actually lead to abdominal pain, and this is known as the adnexal mass or tenderness. All right. So we get to break down this concept so that you guys will understand it forever. All right. So we talk about the adnexal mass or tenderness. All right. So looking at this, first of all, let's define it. Okay, what is an adnexal mass? After definition, we'll look at the causes of these adnexal masses. I'll look at the symptoms, look at the diagnosis and treatment of this condition, right? So let's move, guys. We said that adnexal mass or tenderness, it actually refers to what abnormal growth or discomfort in the adnexa. So now, what is an adnexa? All right, we said that an adnexa is when you are referring to what fallopian tubes, ovaries, and the surrounding tissues. Okay, so if I'm talking about this fallopian tube, if I'm talking about ovaries, and even the surrounding tissues, okay, I could call this area an annexa without the L. Okay, but talking about masses that are related to this area, that's why you say annexal mass. You get the difference now. So any masses in this place could either be benign or malignant, right? That means it could be soft or friendly, or it could be cancerous, okay? And when it becomes tender, it can indicate what? That probably the place is inflamed or there's an infection or irritation, okay? So what are the possible causes of adnexal masses or tenderness? It could be ovarian cysts or tumors. It could be ectopic pregnancy. It could be tubal abscess or infection, all right? It could be endometriosis, right? It could be adenomyosis. It could be as a result of what pelvic inflammatory disease. It could be what ovarian torsion, all right? So you could see this anything, all right? Any growth, either in the what fallopian tubes, in the ovaries, in the tissues around like the uterus, okay? Any growth around this area is what we call the adnexal mass. And we say that this mass could be benign or malignant. So what are the symptoms? Of course, there'll be pain there and there'll be tenderness, all right? And this could result to what? Abnormal vaginal discharge. It could lead to abdominal swelling or mass, okay? It could lead to pain when the woman tries to have sex, all right? That's painful intercourse. It could lead to urinary frequency or urgency, okay? What are the possible diagnoses of this condition? Like if you want to confirm that this condition is there, you could do a pelvic examination, right? You could do an ultrasound, okay? You could do a CT scan or MRI scan, all right? You could do what? A laparoscopy, where you make some small incisions, you put a laparoscope, all right? All those instruments actually have those cameras at the head, all right? So that you can observe the internal environment. Then you can also do a biopsy, take off some tissue, send it to the lab for lab results, okay? So treatment for this adnexal mass or tenderness actually what involves the following. You could do a watchful waiting. That's if it is just starting, all right? Because some of the inflammations and all those stuff might resolve on their own. That's if the person has a strong immune system, all right? Then you can also administer some medications like antibiotics, hormonal therapy, right? You could do surgery like ovarian cystectomy, right? To cut the ovaries out, right? You could do hysterectomy too, right? Then you could also do some chemotherapy. That's if it is what? Malignant, right? So that's it about the concept of what adnexal mass or tenderness. Basically talking about the causes, symptoms, diagnosis, and treatment.